My name is Dr. Ng. May I examine your eye today?
Yes, please.
Before I start, do you have any pain anywhere at all?
No, doctor.
Great. We always start with inspections. Step back, observe for the head posture. Check for any swelling, scar, deformity over the orbital regions. Request the patients to look straight in front, and we look for the alignment of the eyeball. Then take a closer look on the eyelid, eyebrow, sclera, and conjunctiva. Before we end our inspections, go behind the patients, look down from above to look for proptosis. For visual acuity, ask the patients to put on spectacles if she has any refractive error. Ensure proper room lighting. Hold the screen at 2 meters away from the patients. Test each eye independently. Here we are using the validated smartphone applications with a dumpling e-chart just as a handy bedside screening tool. This is not meant to replace the classic Snellen chart. Ask the patients to hold the near vision chart at her routine working distance or at a distance of 30 cm. Instruct her to read from top to bottom. Again, test each eye independently. Use a red color pin, and the pin is viewed with each eye independently, and the apparent color are compared. Look at the red. Is it the same?
Yes.
Now?
Yes.
Confrontation tests can be done by various methods. In kinetic perimetry, moving stimulus is used. Make sure the unexamined patient's eye is completely covered. The examiner also closes the eye opposite to the patient's covered eye. Have the patient to focus her gaze on the examiner's nose. Instruct the patient to tell the examiner when the moving target is first seen. It is convenient to use a wiggling finger, and all 4 quadrants are checked. Finger counting field is using a static stimulus. In redox phenomenon, the kinetic perimetry might appear to be normal when finger counting in each quadrant is not. 1, 2, or 5 fingers are presented in each quadrant, and the patient is asked to report how many fingers are seen. The distance between patients and examiner is 1 meter. The reed pin need to be positioned at an equal distance between patients and examiner. Ask the patient to say when the red part of the pin is disappeared. After the red pin has disappeared, continue to move it laterally and ask the patient to let us know when she can see it again. When we check for pupil functions, there are a couple of key things. First of all, is the light need to be dimmed and shine the light from below. Then inspect for the pupils. Are they equal in size, regular in outline? Are there any foreign bodies such as a lens implant? Light reflex including direct and consensual. Ask the patients to fixate on a distant object in order to eliminate the accommodations reflex. While maintaining the same test conditions in testing light reflex, the light should cross from one eye to the other in a U-shaped motions to avoid accommodations, and hold 3 to 5 seconds in each eye to allow pupillary stabilizations. For accommodations reflex, ask the patients to look into the distance, then look at the pin at 10 cm in front of her nose. Inspect for convergence of eyeball and pupil constrictions. Request the patients to keep her head still, permitting only the eye to move. Place the finger 50 cm away from the patients. Move the finger in the figure of H. Ask the patients to tell if she sees doubles. The examiner also needs to observe the range of the eye movement and pick up is there any nystagmus. Isolated testing of superior oblique muscle can be done by having the patients to look down and in. In these directions, the actions of the inferior rectus muscle is cancelled, and the actions of the superior oblique muscle can be isolated. In tests of skill deviations, request the patients to stay at a distant point. The examiner is alternating covering one eye after the other. Look for compensatory vertical movement of the eye that was just uncovered. For saccadic eye movement, face the patients, Hold both of your hands out about 30 cm in front of the patient. Two hands are 30 cm apart. Ask the patient to look from one hand to the other. Look particularly at the speed of adductions and repeat the test by putting the hand vertically one above the other 30 cm apart and check for the speed of adductions again. For head impulse test, explain to the patients regarding the procedure. Ask the patients to fixate at the examiner nose. Grab the patient's head gently and move side to side. Ask the patients to keep looking at the examiner nose. The key here is, with warning, do a head thrust with sufficiently high peak velocity at about 120 to 150 degrees per second. In normal conditions, the patient's eye should remain stable without any corrective saccades. OKN is a physiological response produced by asking the patients to visually track a succession of moving stimuli. Here we are using a OKN stripe in a smartphone applications. By clicking on the screen, the speed of the OKN rotating drum increases. Ask the patients to look at the display center and count how many dark bar passes the display center, and we observe for any asymmetrical OKN response. When listening for an orbital breath, use the bell to auscultate the eye glute. To eliminate the noise of the eyelid muscular contractions, instruct the patients to open both of her eyes and gaze at a distant point. Then the eyelid passively shut by using the bell of the stethoscope. We will perform fundoscopy at the end of the examinations. It is essential to darken the room for the fundoscopy. Always explain to the patients the process of examinations. When examining the patient's right eye, hold the ophthalmoscope with your right hand and look with your right eye. When examining the patient's left eye, hold the ophthalmoscope with your left hand and look with your left eye. Check for braid reflex. After assess the optic disc, check the macula by asking the patients to look directly into the light of ophthalmoscope. We have done with checking the fundus. We have went through all the elements of examinations of eye, summarized all the findings, and assess other cranial nerve or system that have localizing value. Thank you.